All right, I want to welcome everybody to the latest installment of our podcast series. It's brought to you by the North American Spine Society, where we highlight articles from the SpineLine publication. I'm Dr. Alex Michael. I'm the chair of the Public Outreach Committee with NASS and a practicing neurosurgeon with Mercy Clinic Neurosurgery in St. Louis. And today we have a special guest, Dr. Scott Kreiner, who's the newly elected president for the North American Spine Society. And Dr. Kreiner is an interventional spine specialist at the Barrow Neurologic Institute. Thank you again so much for putting this together and for your first, SpineLine publication and podcast.
Uh,
So, why
yeah,
don't you
thanks for
tell
having me.
us, yeah, why don't you tell us a little bit about why you picked this topic to begin with?
Yeah, well, that's interesting. It's a great question. So currently at our institution, we are in the process of changing electronic medical records. And,
That's a
one of
huge
the,
ordeal.
yeah, it's a huge ordeal.
We've been
Exactly.
through it
And we're
not
going
terribly
from
long
the,
ago.
yeah, exactly. So we're going from the old version of Athena to Athena 1. And one of the, um, selling points that they came in was something that they called, I think it's called iScribe, which is a generative AI platform where you have an app on your phone, an Athena app on your phone, you turn on a microphone in a room, and you carry on your conversation with your patient in the room after you get their permission, ask all the pertinent questions, do your exam, you know, spell out what your, exam findings are out loud, and develop an impression and plan with the patient, discuss everything. And then by the time you get back into your exam room, the note is transcribed from the features on your, what your app heard in the room to a clinical note in every sense of the word. And so basically replacing the scribes that we pay for right now. And I was like, holy cow, this is just incredible technology and will save not only money for paying for scribes, but save time and become hugely efficient. And I'm like, it's just phenomenal. And so,
Yeah, that's game changing.
yeah.
Well, so to be honest, whenever I found out we were doing an AI podcast, I took your the transcript from it, which you can actually find at spineline mag.spine.org. And I'll say that again at the very end for anybody that wants to look up the actual publication. And I input it into ChatGPT. And I was like, ChatGPT, can you create a podcast dialogue for us to make an actual podcast? And the result was just terrible. It was just like it didn't flow well. It was really choppy. It was really short. So there's just some imperfections with AI, but maybe that's an older version of ChatGPT. But what they're doing within medicine and with the EHRs is, kind of game changing. It's a little bit more refined, and we're experiencing the same thing in every facet of medicine. We actually had a previous podcast with Dr. Denisa. He's from Loma Linda. He's a spine surgeon. And it was a little bit more toward the surgical aspects of AI and what they could do with augmented reality, with 3D printed implants and stuff like that. So I thought yours was extremely timely and even more appropriate for just really any practicing clinician. Like this is something we could all use. That ability for the EHR to store all of this information, synthesize all the information, and then compute all of these different variables that we as clinicians have learned to do on our own. That's really like the art of medicine is what a machine is going to be able to do. So just improving our efficiency was, I think, just a huge component of what we're all looking to get out of AI. Would you tell me a little bit more about the front end, before the patients even get to us? That was kind of the most eye-opening thing for me is there's even more on the back end that our, MAs, our nurses, our office staff can gather from using AI that could, increase the throughput for our patients and improve efficiency that we don't even see before the patients even get to us.
Sure. Well, I mean, of course, I think it all makes sense where, we have these pieces of ID, we have a driver's license, an insurance card,
Yeah, exactly.
an optical character recognition can take the information from those IDs, um, take that in the back end, go into the patient's insurance company, find out what their benefits are, determine, what their deductibles are, pull up, potentially what coverage policies will apply towards what you're trying to do, look at all the benefits, determine, do you need referrals? Do you need, what you might need, and populate that into your electronic medical record so that as you're trying to care for the patient, you might know what roadblocks you need to hit. And it goes so far now as where generative AI is, actually able to look at a specific payer's requirements to order an MRI or order, when you put in your order for, if you're planning on doing an ALIF, like what treatments have they had, what have they failed, is that all documented in the record? And making sure that you've documented that they've jumped through each individual hoop that they have to hit before they become a candidate for whatever procedure that you're trying to do. And then unfortunately, or probably what you would expect, the insurance companies are using this on the back end as well, right? They're using it to scan the notes that we create to say, okay, well, they haven't jumped through all these hoops, so we're going to make a denial.
Oh, I didn't even think about that. Yeah, that's a
Yeah,
great point because then we can preempt that and get the appropriate documentation already,
e-
in
exactly.
line, in line with what their AI is going to interpret. So, oh, that's a great idea. And
Yeah,
then you mentioned that there's trends in billing and coding errors that potentially can pop up. Uh,
yeah,
it might, preempt some of that stuff. So they would all know the payer policies and preempt some of those denials and appeals and whatnot to optimize some of that workflow.
exactly.
And then the other really interesting one that I think should be a no-brainer, but using chatbots. This is something, we see almost, throughout any kind of, online marketplace.
Mhm.
Um, in medicine, that it we utilize medical assistants that maybe don't have the the full breadth of surgical knowledge that even our nurses have. And I don't know if you have to have that necessarily to be able to communicate some things to patients. The chatbots, I don't know if that is a slippery slope to take some of the personal interaction out of medicine, or if that could help with the vast majority of stuff. Because after I read your article that week, I got the most random set of questions from patients, and I do brain tumor surgery too. And I saw a young girl with a low grade brain tumor, and she's asking all kinds of questions through our portal about, should I get this vaccine? Should I stop this medication? And then, the dialogue kind of went on for like 2 days talking to my
Right.
nurse. And she's got to then forward that to me. So it ends up being a big time sink. So using AI to kind of draw all of the literature about a certain topic and then answer the question for the patient, would be such a game-changing thing, because not only would it be highly accurate and higher level than probably stuff I know that are these really obscure questions. It just makes it so much more efficient too. I don't know if you had thought of anything else along the health assistant chatbot, but I just thought little things like that could make a huge, huge difference. And this whole article has one line possibilities that are by itself just a whole company almost.
Right. And it's not necessarily that it's replacing the physician, it's making the physician more efficient, right? So, like you said, the patient's coming with all of these questions, and they're valid questions, but the amount of time it takes you to respond to that, if you're to go, make sure you're accurately answering a question, you might have to, research, the label on a vaccine or something just to try to figure it out.
Mhm.
When these chatbots could respond to it with that information, which readily available to them in a much quicker time, and then present you with, this is the information and this is why, these are the citations, and then you can provide that to the patient, but you get to verify everything, right? So
Yeah.
it's not like pulling you out of the system. It's just making your ability to respond faster without taking as much time, that we're not getting reimbursed for as physicians, by the way. That, we don't get paid to respond to all of these inquiries that we get all day. So that is it's a huge game changer, right? Like it makes sense if we can do something to make that time more efficient. then we can spend it doing, something else. So,
Yeah, no, that's a good point too. It doesn't necessarily need to be a chatbot to answer the question without us. It could just present us with the info, and then we can verify it and send it back to the patient a lot quicker, and feel a little bit better that we're given accurate information.
right.
You had a next topic of diagnostics and imaging, to help aid in diagnosing conditions such as degenerative spine disorders, trauma, tumor infection. Can you tell us a little bit more about that?
Sure. Well, it's pretty clear anytime you walk anywhere now, like an airport or whatever, that, optical recognition and cameras are a huge part, right? Like that you don't even have to give an ID in the airport anymore now. At least at Phoenix, we don't. We walk up and something takes a picture of us, and they already know who's getting on the airplane and everything else. Well,
Mhm.
it's the same technology, only with a black and white image for the most part when we're looking at spine imaging, right? Computers can easily, interpret massive amounts of data from an imaging source, whether it's an MRI scan, X-rays, CT scans, whatever. And there's plenty of studies that they can show that it is at least as accurate as the most experienced radiologist reading some and interpreting these images.
Mhm.
And so, again, I don't think the goal necessarily is to eliminate um, physicians from being involved in that, but if it could point out there's this, at least for critical findings or whatever else, it could generate basic notes. But at the same time, when things are critical and we really want to point out somebody needs to look at this and pay attention here, it can be hugely helpful. And so I think we're going to see a lot of that. I think there will be a big change in how radiology works as the future comes with regard to imaging and recognition through that through
Yeah, I
that
thought I thought of two components to it. One is like the bread and butter radiology reads, the uh, disc herniations and central canal stenosis and stuff that's so repetitive, that they can really homogenize the output, and it really speeds up the workflow. Just like any other component of the AI that we're really keen on is, allowing us to do more with less. And then the second one was catching more that other maybe untrained radiologists don't catch, the far
Mhm.
lateral discs, the
Right.
accessory facets, the Bertolottis, stuff that, maybe unless you're really looking for it, you don't even think about it. Or, maybe you had a couple of recent patients, and so you start trying to look more and, trying to um, get everybody up to speed to having a decade of experience, as quick in their career as possible. And that's really what, AI could potentially do with something like that. I've heard of a couple companies doing it, and I don't know if it's moved to the EHR yet, but um, I think that the imaging portion is, one of the most exciting things for me after the help with scribes.
Right.
And that kind of leads to the next thing, the precision treatment planning. And, probably one of the biggest benefits that we have as clinicians are around, personalized precision medicine and the, evidence-based care that we know of integrating with experience. And
Mhm.
there's just a massive amount of variables to go back and forth that circle around in our heads. And some of it is, low level evidence, but it's based off of, prior experience on how these patients are going to do and what's going to work for them and whatnot. So that's kind of the art of medicine. And do you have anything you want to go in on the, more precise treatment planning for some of these patients?
That honestly, I think this is going to be the farthest piece of this technology to lag, because
Hmm.
I think our evidence on precision treatment plans isn't strong enough yet for it to be completely accurate most of the time, right? Like we in our last annual meeting, we sat and had a huge symposium with, the NIH and PCORI and everybody else talking about, multidisciplinary treatment plans and who's the best person to operate on early versus who can wait and how you decide. And, all of these things, we don't have enough good studies yet to say, oh, well, you know, person A with this disc herniation could probably wait, and person B is probably going to do with the same symptoms. And you know, there may be nuances that we don't necessarily know on who's going to get a better outcome by, you know, having a microdisc sooner versus saying, oh, the epidural steroid and time is a great solution for this person. And, you know, how do you necessarily navigate that? So I think some of that some of those answers I don't think we fully have yet. So I don't, but at the same time, it can develop, it can look at large bodies of evidence that do exist and help determine, you know, that's what AI is great at, right? Is like looking at much larger bodies of evidence that are out there than any one of us can spend any amount, you know, substantial amount of time doing, to try to help develop treatment plans. So it's really interesting, but you know, I think that's one of those things that I don't, I'm not as, I don't think as nearly eminent as many of the other things in AI, at least in spine care. It might be in other fields of medicine, but at least in spine care, I don't think it's nearly as eminent.
Well, we're better to store a large volume of data than within that current EHR. So that it's creating the ability to find all of these variables and then store them. We just need to make sure that we're able to input the right variables, I guess, the ODIs and NDIs and all those disability indices. And I don't know if that's currently available in some of these EHR iterations. We use Epic, and I'm sure there's a pain score somewhere
Yeah,
within Epic, but for us, you know, it's still, you know, circle 0 to 10.
right.
How bad is it? And it can't be a hard fix to actually integrate that with the HR and keep track of all those things. It's got to be an easy thing to do.
For sure.
And that's really where the value would lie in the future with these EHRs. They're sitting on such a big repository of data that we can then use to create these studies to then find, you know, who's going to have the best outcome. And it could take a couple of years to collect, but if we do it over a large number of high volume centers, then you know it shouldn't take as long as we thought. You know, I'm with Mercy in St. Louis, and I'm pretty sure we had one of the biggest rollouts of Epic throughout our whole organization, and I know that they have one of the biggest repositories of cornea cornea imaging. And I forget exactly. I wish I would have looked it up what they're doing with it, but you know that's the most valuable thing for all of us is just having that data to start with. Um, but the next one I thought was a little bit more industry driven, and that's some of the remote monitoring and proactive care. It talks a little bit about wearable devices, collecting data
Mhm.
points on patients' posture, and to me that seemed like is more preventative type stuff,
Sure.
but it could also be certainly rehabilitation.
Yeah. And there's already uses being kind of, you know, in the physical therapy landscape, there's, you know, in addition to just having wearable technology, there's apps with exercises and, you know, exercise, you know, specific spine exercise programs that are arranged by the physical therapist to work into a home program. Wearables can monitor, are they doing the exercises, you know, as instructed, and, you know, incorporate that stuff and communicate directly back to the provider, um, you know, that they're doing their exercises in addition to, you know, balance, all frequency, all the other things that we start to get concerned about, as healthcare providers and as spine providers. You know, if somebody's, you know, having weakness in their legs or increasing balance issues, they may be important indicators for us as clinicians. That's something that we might need to address. And so, yeah, the wearable technology thing will be incorporated, and a lot of that will just tie into the EMR as well, as we see, you know, some of these big tech companies like Apple advance that, their health, um, piece in their infrastructure into electronic records. So I think it's all going to be one, you know, big part of healthcare, right? Because the vitals are there as well, and you know, the primary care docs can track, blood pressure, pulse, oxygen saturations kind of throughout the day. I mean, all of that stuff,
Right,
is
right.
part of
Instead
our
of
health.
being at the point of care in a clinic setting or hospital.
Yeah.
Well, there was a device implant manufacturer, one of the big spine companies, and for a while there, they had tried to get a lot of feedback about it would, surgeons want implantable devices with that same technology. It gives
Mhm.
like some data points on axle loading and torsion and yeah, stress on the screws and maybe even fusion rates in the future too. And I haven't heard much about it since they started talking about it a couple years ago. But I know the biggest feedback they got was that's privacy concerns. Like you got to, first of all, get a consent from the patient, and there's not many people that might want to undergo the consenting process for it. And that really tied into the last component of your article too, some of the challenges, ethical concerns that we had going forward. All this data being freely available, there's a big privacy concern with it. And
Sure.
um, at what point do we consent somebody to maintain their privacy, and what of it is implicit because we're healthcare professionals and we have a HIPAA and whatnot. So I think that was probably the biggest component is the privacy, and then a lot of like education would need to happen and training, repurposing of workforce, repurposing of people, and if we're not utilizing them in one aspect, we're using them in a different one. I think of that almost every time I go to the grocery store, and I try never to go to the grocery store, but when I
Mhm.
do, it's the checkout where there's one person monitoring, 4 to 8
Right.
independent self-checkouts now instead of 8 checkers. That
Sure.
that same concept.
Right. Well, and the data that we grab and we evaluate and we monitor to help make patients better, you can be assured that life insurance companies and health insurance companies are using it to minimize risk.
Hmm.
And so, um, if you're applying for a life insurance policy, they're monitoring all the medications you take from your sources, and if you don't give them permission to do it, they won't even look at underwriting your policy, right? So it'll and that's going to keep going further and further. It won't just be medications, it'll be other pieces of the medical record that they're going to demand, to when they're looking at life insurance policies and trying to figure out how insurable are you and everything else. And so there's definitely implications that are pretty far reaching with regard to the technology that we're using with regard to healthcare and how it can impact, um, you know, multiple parts of our life specifically with regard to, insurance coverage, and, with health and life insurance. So,
Yeah, great point. Well, as I, was seeing how I could apply this to my own practice, I didn't know if the EHR itself is a barrier. Have you encountered any that are third-party applications that integrate with these EHRs, or is the scribe that you had talked to in the opening, was that all within the Athena EHR? Or was that something separate? Do you see that as a barrier? Does these EHR companies kind of have a monopoly on the ability to use independent software programs or independent applications, or is there opportunity for small company development of some of these minor components?
sure. Well, we're seeing there's a handful of new, scribe AI
Yeah,
startups right now. There's a bunch of them,
I've
and
heard of
so
a couple. I'm sure there's a ton of them out there.
right. And so, Athena has their own, right, that they've developed internal, and I think Epic has their own. So the two largest players in the market can afford to do that on their own. But I think, you know, there's a there's a cost to jump into that space, um, and you have to evaluate, as you're a company, does it make sense to do that on my own, or does it make sense to try to partner with somebody, who's developed it otherwise? And so I think we'll see some of the smaller companies choose to outsource that, or integrate it, separately. I think we're going to see all kinds of things. So, I think the big systems are going to continue to use the bigger EMRs, and those will have their own. I don't think we're going to necessarily see that be outsourced.
Okay, yeah, I was just thinking if I knew of one company that was doing something very well, I'll use the scribe for brevity, but if they were doing it just blowing Epic or Athena out of the water, is there even an opportunity to use it within those existing ones? Is that even compatible?
Yeah.
And I haven't looked into it enough. I didn't know if you saw that ability, if that's even feasible to do, or if it would have to separately transcribe it somewhere else and you copy and paste it into your existing EHR.
Yeah. So they my bet is, without talking to the vendor directly, they have a lot of mapping capabilities within their system, and as we're currently going through this transitioning from our old EMR to the new EMR, they have a way where they can look at whatever fields were filled out and transition them over. And I assume it would be very similar with whoever they're trying to integrate with, that they could map an integration technology into their EMR
Hmm.
platform directly to allow implementation. And I know that they do that with vendors and other things, right? Like with imaging centers, where to bring in the, the radiology reports and the like. And so I'm sure that they could do it with, um, with an AI-based scribe as well.
Certainly come a long way from the paper charting. It's just
Oh,
crazy that
yeah.
we're talking about this now, and it just a decade ago is when I remember our last medical school rotation. They got rid of the paper charts and transitioned to EMR. It
Yeah.
was like 1 week on our surgery rotation, and that was it. Never, no more paper charting, and here we are.
Right. Right.
Um, the only other thing that I could think of that wasn't part of the uh, that AI wasn't a part of in your paper was just the patient acquisition, and that's almost another separate podcast. How do we utilize AI to actually get more patients, either target the PCPs that are referring or target the public and help with marketing. And otherwise, I thought, very, very comprehensive and exciting stuff. And thank you again for all you do. Congratulations on becoming president of NASS. And let us know how we can help support you. Thank you again for putting this together. And for anybody listening that wants the actual um, magazine article, it's spinelinemag.spine.org. So Scott, thanks again.
All right, Alex, thank you. It's been a great time. I totally appreciate it. Thank you.